Hello, and welcome to the podcast series. In this edition, we discuss the burden of drowning and drowning prevention measures. Joining us today, we have a University of Cape Town Associate Professor and also the Head of Ambulatory and Emergency Care at the Red Cross War Memorial Children's Hospital, Professor Heloise Buys. Professor, welcome.
Thank you very much.
And thank you for helping us understand just how serious drowning is in South Africa. Is there maybe some guidelines you can give us in terms of an umbrella? How big a problem is it?
Unfortunately, drowning is a huge problem for South Africa. The particular age groups are all children, including those under 19. So. Right. Generally speaking, many hospitals manage children up to the age of 13, 14, but even up to the age of 19, they're considered children elsewhere. And that's the highest group that suffer fatal drowning.
From out of the entire population, even the adult population, so 0 to 19.
Yep, that's the, so we're getting roughly about 20 children per year drowning, which is a huge number, because it's a preventable problem. It's a tragedy.
Right.
And all over South Africa, okay, the highest rates are along the coastal regions. That makes sense because we've got a huge ocean. So the highest rates are seen in KwaZulu-Natal, Eastern Cape, and of course the Western Cape. There's also a huge number in Gauteng, and I'm not sure why, but you have to remember that drowning is not just about swimming pools and the sea. Many children, particularly the highest vulnerable group is the under 4.
Right.
These are toddlers, infants, who move around the home, and because our parents, might be very busy, they may not recognize that a bucket standing half full with water is actually far worse than a swimming pool. Children love to explore, and so they go put their hands in the water. Due to the size of their heads, which is relatively large at that age, they tipple over, they lose balance, and then they can't right themselves.
Right.
And that's the tragedy. And it literally takes a moment. You hear so many sad accounts of how it happened. I just turned my face away for a minute. I just did something for less than a minute, and this is what has happened. It's extremely sad.
So I've also noticed, it's very interesting that you mentioned that it's not only the saltwater bodies. So literature is also showing us that the freshwater bodies like latrines, cisterns, wells, and those type of things are the largest contributor to fatal drownings.
That's correct.
Yeah.
In fact, another huge problem that has come of late in South Africa, people are stealing the manhole covers, and that creates a huge danger.
Risk.
Because now children drop into those, fall into those and can't get out. Latrines, how sad is that? Freshwater bodies, lots of that happens as well. We've got dams, we've got rivers, we've got climate changes that have contributed, the flooding of rivers. Many children in South Africa, even though we don't see it in the urban areas, cross rivers in order to get to schools. And so when there's flooding, they think that it's still okay, and it's not.
And it's not.
So that's a tragedy of poverty.
Yeah. And so how much water does it take for a child to drown in? I mean, a lot of people think that it has to be a swimming pool or it has to be like a large body of water.
So if you come back to the analogy of the child falling head first into a bucket, you just need enough to cover the forehead and the nostril and the mouth. And that's about 3.5 centimeters, 4 centimeters of water.
Right.
That's a minute amount of water, and yet it's fatal.
Right.
Yep.
So in our quest to assist parents and caregivers and anybody that's responsible for minding children around bodies of water, the importance of first aid. I mean, what is that first response?
It's critical. Okay. So before we even get there, you must talk prevention. The thing is keeping your eyes on your children at all times, particularly if, mother's doing the housework. she's got to make sure that any buckets are way out of reach, and she knows exactly where her child is at all times. So should the unfortunate happen, the first thing is to remove the child from the water. So it could be a bucket, could be a bath, could be a pond, could be a swimming pool. Remove the child immediately. Now, there's a bit of a caveat there. You don't want a secondary disaster. An adult should not jump into water if they don't know how to swim.
Right.
Because now we'll have two tragedies. And so the first thing is also, if you know how to do CPR, then you should immediately do that. Okay, because the outcome of a child recovering where there has been even layperson CPR done is much, much better than where children have received no care until EMS come, the emergency medical service arrive. And so basic life support is important. And so again, it's another preventive thing. What parents can do, apart from keeping their eyes on, they can learn to swim themselves. They can get their children to learn to swim. It's very important. It's a life skill. They should know what the emergency telephone numbers are. You need to know who to call when you need help. So the emergency services, can I say them?
Yeah.
So there are a couple of numbers that come to mind. The easiest ones are the one that you can use from the landline, which is 10177. You can also use it from a cell phone. The other number from the cell phone would be 112. And then, of course, there's a whole lot of private emergencies, and I don't really want to name them, but they have easy numbers. And so I always teach safety to our nurses who come for basic life support training. And I make them put an emergency number on their cell phones the minute we start that lecture, so that they can help others outside in the communities. Everything's here in the hospital, but outside in the communities, you need to know who to summon. So that's quite important. You can go and learn how to do basic life support. There are courses that St. John's, I think, runs courses for that, so that's quite important. So if a child has drowned and you've got them on the floor in front of you, obviously the first thing is to try and make sure that you clear the mouth, open the airway. So that's part of basic life support, clearing the airway. And so if there's a huge gushing of water, quickly tip the child onto the side so that the water can drain out, and tap them gently on the back so that they can begin to cough and splutter out any water that has been. If there's no response to that, and there's no water that you can see, and there's no response, no signs of life, no movement, no blinking, then you'd have to start the CPR. And this is what we teach as a basic life support and life-saving measure. Ambulance drivers, the EMS, the emergency medical services will arrive with the oxygen and other advanced support, but there's a lot that you can do before they arrive. And that's important that it gets going. The other thing is to remember that children have very small bodies, and so they very, very quickly drop their temperatures if they've been exposed to cold water. And unfortunately or fortunately, our water in South Africa is not cold enough to be a protective measure for the hypoxic brain injury that happens with drowning. And so you do need to make sure that you dry the child's body and take off the wet clothes and cover with something warm so that they don't become hypothermic, which becomes problematic as well. So summon help, start the basic life support, and you don't stop until help comes.
Okay.
So that's quite important.
So you mentioned an important thing, hypoxic. Can you help us understand exactly what that means?
Okay, so hypoxia is when you're not having good gas exchange in your lungs because of the water that has come in. So with drowning, what happens is a child falls in. Let's put the child into a swimming pool or the sea, and they, unlike adults who's drowning will shout and scream and then go down and then come up and continue to fight. A child is so focused on breathing that they don't signal with shouting. It's actually quite a silent and terrifying accident. It's a silent thing that they go down because they're trying to breathe. So that breath underwater causes the vocal cords to go into spasm
Right.
in an effort to stop the water from going in. But that can only last so long. If the air is not supplied immediately, then you will get relaxation, and the vocal cords will open and water goes in.
Right.
And that causes hypoxia, lack of oxygen supply to the brain and other vital organs. And that is ultimately what kills people.
Right.
And causes brain damage. So drowning is not a benign thing. If you don't die, you might still suffer terrible brain
consequences.
Damage.
Yeah, in the mid and long term.
Yes.
Right. So there are certain complications that can set in as a result of drowning, even when a patient has been removed from the water body and was successfully resuscitated. One of those would be secondary drowning. It's something that most people are not aware of, particularly when they've done the, can I call it, rescue themselves. Can you help us understand what a secondary drowning is?
Okay, so it is an unusual form of drowning, but very serious, because you've got to recognize that it can happen. If a child has been submerged, in other words, face down or head down underwater for a period of time and has been rescued from that and has coughed and spluttered back to life and seems completely fine, you must be very careful. Because when the water enters the lungs, it causes an inflammatory, it's very irritant, it causes an inflammatory reaction. And whilst the child might be brought back to life by the efforts of the rescuer, they cough and splutter, they vomit vomit the water out of their tummies.
Fluid, yeah.
And they appear to be quite fine. In the hours following that event of a bit of water aspirated below the vocal cords and into the lungs, there's an inflammatory reaction that is set up. And with inflammation, there's fluid that exudes into the lungs. So in other words, now the body is creating a drowning within the lungs that has come from the body rather than from anywhere else.
Right.
And that again interferes with oxygen delivery and exchange. And that can be fatal. And so it's always wise to take the children, should such a terrible event happen, for a checkup. And very often one would keep them in and observe them for 24, sometimes 48 hours.
Right.
One is worried about them. Very often they would have x-rays and some other tests just to see what the effect on the body has been of being submerged in water.
So if you have had an incident or should have an incident where a child was submerged and did ingest or take in water and was successfully extracted, it is always a good idea to visit the emergency room to ensure that post-drowning complications is averted and avoided. As the professor explained, it can be fatal. So if we now break down that 20 fatal drownings per year based on what the figures are saying, that's bringing us to about 1 to 2 deaths in children every day.
Yes,
every month.
Per month.
Yeah.
Per month. Yeah. And that's a huge number.
Yeah.
Because drowning is a preventable thing.
Right.
And so why should a child have to face that consequence? And it comes down to prevention. And so it's important to raise awareness with parents. So again, having a swimming pool or swimming in water, dams, rivers, if you as a parent are looking after a child, and I've given you the age group. Right.
So 0 to 4.
You literally must be within arm's length of your child in the water. So that you know that should anything go wrong, you are there to save the child. There are a certain category of children that we particularly ask for that to happen. Children who have epilepsy must always have an adult who knows how to swim with them, because we don't know when
a seizure might set in.
Can happen as well. The parent themselves ideally should know how to swim, teach your children how to swim. Never leave a child unsupervised in a swimming pool or in a bathtub, for that matter. You must make sure that if you have a swimming pool, you follow legislation. Did you know that we have legislation which mandates that we are supposed to have swimming pools with fences that are secured, that are high enough for children not to climb over them? And the second thing that is required is a cover for the body of water. So that could be in the form of a net or a cover.
Right.
So all those things are legislated, but I'm not sure that that is followed.
Or
And
enforced.
from what we have heard and seen, we do get quite a few drownings of children in swimming pools. Always when we ask, no fence, no cover, no adult supervision. So it's something that we need to think about as a society in South Africa. We need to bring that number of children drowning to zero. Really and truly, there is no reason why it should be so high.
Professor, is there anything that you say parents or caregivers must never do in the event of a drowning? Is there any advice that you can give them that they must not do that could potentially further damage or create further problems, even if they're on their way to hospital?
So most parents get such a huge shock when they pull a child out. I think the best thing is to be very, very careful with the neck of the child. Because if they did not see whether the child ran, jumped into the off and slipped and fell into the pool, they may have hit the back of their head. And by doing that, that could have injured the spine of the neck. So you must be very careful when you bring them out of the water, put them down. You might have to turn them over gently to let water out, but they should not shake them, okay? One of the things that people like to do is to shake, thinking that they can get things out of the lungs fast. It doesn't help. It actually causes whiplash injury, which may exacerbate any injury. I don't think that, other than that, I can't see how parents would do anything other than try and do some mouth to mouth. It's probably a good thing. But they must be aware that the child is likely to vomit out some water, which is fine. They just need to turn them gently onto the side so that the water can drain out. And calling for help early is always important. So, people should have their telephones within reach. Also, you should have rescue equipment if you're going to do a swimming event. And that rescue equipment doesn't equate to those airfulls things, armbands. Those are not good enough. You need to have a proper life jacket or something that will save a child's life. So that should be at hand if possible. If you're going to go as far as having a swimming pool in your yard. As with regards to buckets, when buckets are not being used, they should be
upside down.
And if there is water, then they're in the sight of the adults at all times, as is the child at the same time, so that we don't have a tragedy from that point of view. I can't think of anything else that people might do that would be something to discourage.
But I think from a data perspective, I mean, we looked at the numbers, and from I think as far back as 2013, we have not really seen a reduction in the amount of drownings, and the incidents still remain.
That's very sad. Because, we are just busy looking at a study at our hospital where we have found 197 cases, which is a huge number over 10 years. And if you look at that data together with the national data, it's a worry to me because it may actually be higher. Because we are only one center. Even though we are a referral center, we are still
just
one center. And so I suspect that this problem is not being given the attention that it should be. And we should try, it is something that we should educate the public on in terms of how to reduce this number to zero.
Thank you very much, Professor, for your time and for your insight. And to the viewers, 1 to 2 children lose their lives every month due to fatal drowning. Beware, take care, And if you've enjoyed the content in this video and would like to see more of it, please like, follow, share, subscribe, so that others may also be able to benefit from the insights you have gained here today. As always, thank you for joining. Until next time, take care.